babies. My name is Dr. Stefani Kappel and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I'm going to be doing a video on hair supplements. Now, last week I posted a video on skin supplements and it was a very long video with very extensive information regarding all of the different supplements and nutrients and how they play a role in skin health. And I wanted to include hair in that video, but it would have been way too long. It already was long enough as it was. So I wanted to dedicate a separate video that I'm posting today just on hair supplements. So if you're watching this video and you're interested in hair health, or you're losing hair, or you've noticed your hair has gotten decreased density over time, there's a lot of different contributing factors that can result in hair loss, and they can range anywhere from genetics, just normal aging, stress levels, cortisol levels increasing, hormone fluctuations, underlying medical conditions, other medications that you're taking. So there's a lot that goes into it. So I just wanted to ask that you follow up with your primary care provider or your internist, whoever follows you for your health, and you just get your lab work done and make sure that there's no underlying disease or cause for hair loss that can be treated with, medical intervention or supplementation in particular. So I just wanted to reiterate that, because hair loss is a normal part of aging, and again, with hormone fluctuations, but there could be some underlying, deficiency or nutritional deficiency or underlying cause for it. Your thyroid, your blood cell levels, many other things that can cause hair loss too. So it's important not to overlook that as well. So make sure that you follow up with your primary care provider, and we'll dive into different hair supplements that are going to be helpful in restoring hair growth. And the next thing I wanted to say is that usually it takes about 3 months of using a hair supplement to see results. And some doctors even say 6 months. I think anywhere between 3 to 6 months is safe to say, but you can't just use it for a month and say, okay, it's not working, and say it's a failed attempt. You really got to give it a really long duration, at least 3 to 6 months, for the anagen, telogen, and catagen phases of the hair to kind of cycle and to regain hair restoration through supplementation to see if it's effective or not. So the first vitamin that I wanted to mention in a hair supplement is the vitamin B complex. So there's lots of different vitamin Bs, and vitamin B is a water-soluble vitamin, so you can't really overdose it. It's water-soluble, meaning that your body's going to absorb what it needs and excrete and urinate any excess out. And the most important vitamin, there's lots of different vitamin Bs that could be helpful in hair restoration and growth, but vitamin B12 has had data and studies that shown that it is helpful in hair restoration and healthy hair growth. And it's important to note that vitamin B12 can also be associated with potential increase in acne. So if you're acne prone, just take that into consideration. Vitamin B7 is biotin, and this is somewhat controversial. Back when I was in derm residency, biotin was known to be healthy for skin, hair, and nails. Then it's more, it was more recommended for healthy nail growth, and then it was equivocal for hair growth. And then it gained less popularity because it could obscure some potential lab results. If you were being worked up for a possible myocardial infarction or a heart attack or an angina, it can mask some really important labs that are necessary in certain situations. So most of my colleagues and I don't really recommend biotin anymore. Many are saying that it wasn't as helpful as we thought it was before. Although it did have good clinical studies and data backing it up, I actually don't really recommend biotin in and of itself. Now, if it's in a formulation like a hair supplement like Nutrafol, I think it's fine, but I wouldn't just take a biotin supplement, although it has been shown in the past to be healthy for hair growth. I think vitamin B12 and vitamin B3, I think the vitamin B complex altogether is really helpful for hair growth, and it doesn't have to just be specifically vitamin B7. The next vitamin that's important is vitamin D, and actually vitamin E also. Both of those are fat-soluble vitamins, so you want to be mindful of how much you're ingesting on a day-to-day basis. If you're taking a multivitamin that has vitamin E and D in it, and another hair supplement that has vitamin D and E, just be mindful of how much you're taking. Given your weight, your medical history, it may change and vary with how much your body can personally tolerate, but you can get up to toxic doses if you're taking too much, so just be mindful of that as well. So vitamin D and E actually increase blood flow to the hair follicle. It stimulates healthy keratinocyte production of keratin, which is what the hair shaft is made out of, and it actually helps with circulation to that hair follicle, maintaining healthy hair growth. Two other vitamins that are really important are zinc and iron. Iron deficiency actually can result in alopecia or hair loss. And so we know that the opposite is true. Once you take iron, that it helps restore hair growth. Again, healthy for the keratinocytes that are producing that hair shaft, healthy for the hair follicle maintenance and overall health and circulation to the hair follicle. So those two, iron and zinc, are important to have in either a hair supplement or a multivitamin that you're taking on a day-to-day basis. And there's also been a lot of research with oils, in particular rosemary oil and coconut oil for hair growth. So lipids, including like omega-3 fatty acids, are also really helpful for hair growth. It maintains a strong barrier. It maintains a strong infundibulum, which is the hair follicle. It maintains healthy skin cells that produce the keratin hair shaft, the inner root, the outer root sheath. All components of the hair follicle benefit from fatty acids, including omega-3 fatty acids and rosemary oil, coconut oil, and you can even ingest this, through cooking or your foods, not only through supplementation as well. Now, vitamin A is another important vitamin for hair growth and healthy keratinocytes in the follicular hair follicle that produces the hair, blood flow to the scalp, and whatnot. So it's important though, because vitamin A is a tricky one. And vitamin A is also what Accutane is, isotretinoin, useful for skin and acne and anti-aging when taken in supplement form. But you have to be careful because getting to too high of levels, A, D, E, and K are the vitamins that are fat soluble and can become toxic if taken in too high of quantities on a daily basis, can lead to hair loss. So you want to get the happy medium of vitamin A in your diet, just enough, not too much, because it can actually have the opposite effects of hair loss. So you have to be mindful of that. But vitamin A is another important hair supplement. Now, vitamin C is another hair supplement that's important. It's also important for overall skin health. It's a cofactor in collagen synthesis, so we love it for the skin. It also has, potent anti-aging effects. It's great for the immune system. It's great for multiple organ systems in the body. But for hair growth, it's been shown over years and decades to be helpful in hair restoration and hair growth for strong, healthy hair and healthy infundibular and follicular cell keratinocyte overall cell health as well, which is going to produce healthy hair. Now, I know a lot of you guys are going to ask me about hair supplements, like different formulations like Nutrafol, and there's like so many, I don't even want to list them here, but I will tell you as a dermatologist, although I don't practice in hair restoration as a large part of my practice, I'm more cosmetic dermatology, lasers, injectables, and minimally invasive cosmetic aesthetic procedures. I'm board certified in dermatology and I practiced medical dermatology for a very long time. And my patients would mostly respond out of all the hair supplements that are available on the market today to Nutrafol. So I'm a big proponent of Nutrafol. Again, you have to use the hair supplement for at least 3 to 6 months to assess its efficacy. And there's different variations, which is really nice. There's postpartum, I think there's a postpartum formulation, there's a peri or menopausal for women formulation, and there's a formulation for men. So it's great to kind of customize this to your age group and to your hair loss and where you are in life, where you are with your hormone fluctuations. And Nutrafol, I think, is one of my very favorite. It has the most data and clinical data and third-party studies that are backing it up. Remember, it's not FDA regulated. It's not FDA regulated like a pharmacologic drug would be, but there's a lot of sound clinical data and even anecdotal data from seeing patients and practicing dermatology for over 15 years that I've seen hand in hand in real life results with patients who have been on Nutrafol with amazing results. So I'm a big proponent of Nutrafol. Again, I'm not sponsored. I have no ties to that company at all. They'll probably be really excited that I'm just recommending them because I really feel that I've seen the most anecdotal data and clinical improvement in patients who have been on Nutrafol. And there's several components in the formulations I think that are really unique. Ashwagandha is a naturally occurring supplement that can be used to decrease cortisol levels. When we get stressed or when we have lack of sleep or when we have some type of external stressors in our life, cortisol levels go up and that can have a significant impact on hair loss and alopecia. So ashwagandha is in the Nutrafol formulation and it can help mitigate that from a more natural standpoint than getting pharmacologic drugs on board. And as I mentioned before, different hormone fluctuations can result in hair loss. And so the conversion of testosterone to DHT is responsible for hair loss. Now, this can be in men and women. Typically, men have higher levels of testosterone and DHT, but as women, as we go through different hormones, different changes of life, we can have elevated levels of testosterone and DHT. So saw palmetto is a naturally occurring substance that's in Nutrafol that can help mitigate the increase in DHT by blocking the conversion of testosterone to DHT, which can help with hair growth. Of course, this is probably more in the male supplement form of Nutrafol, but in the female form, I actually haven't looked at the formulation to see if saw palmetto is included in it, but it would be helpful for women who have maybe higher levels of testosterone or lower levels of estrogen to have the saw palmetto component, not only if they take Nutrafol, but even as an external supplement as well, as this has been shown in clinical studies and a lot of third-party studies. An organic maca root is also included in that supplementation, and if you wanted to get it as an external supplement in and of itself, it's shown to have correction of hormone imbalances that can also lead to alopecia in men and women. So whether you have it in a hair supplement formulation that's already kind of generated for you, or you take it externally and you want to pick and choose what supplements to use for hair, that's also a really important supplement to have for healthy hair and hair growth and correction of any form of alopecia. And mostly what all these supplements do when we talk about hair restoration is they work by different mechanisms of action. So as I explained in the skin supplement video that I posted last week, the way that hair restoration, vitamins and minerals, nutrients, antioxidants work is they supply a healthy blood flow to the scalp or the terminal hair follicle. They promote healthy cellular activity through the keratinocytes that are producing the hair shaft, and they provide keratin synthesis, different cofactors and different enzyme upregulation to synthesize healthy keratin and healthy hair in the hair. They also optimize nervous system function, which can have a dramatic impact on hair growth. And they also increase blood supply and oxygen delivery to the hair follicle. So those are the main mechanisms of action for most of these supplements that I discussed today. And the ones that I discussed today, because there's so many, and I don't want you guys to get so overwhelmed by doing your literature search and your research search, through medical data and our medical journals and our academic meetings, these are the supplements that get the most attention in 2023. And I'll be doing an updated video once a year on not only skin supplementation, but hair supplementation as well, because the data and the new information is always coming out. It's a rapidly advancing field, and I want to keep you guys in the know. Thank you for your support. Sharing this channel is the only way to grow on YouTube, since I am non-sponsored. And just drop a comment in the comment section and let me know what you guys want to hear about next. Thank you so much for your support. I love you guys.